Good evening to my fellow friends. Today our group will be presenting tissue engineering of skin graft. Our group member consists of Liana, Voisin, and also me, Yokching. Now I will be explaining the background of skin graft. As we all know, the skin is the largest organ in human body. It performs a large number of functions which are crucial for survival. The main function of skins is to act as a protective barrier against harmful ultraviolet radiation, chemicals, and pathogenic microorganisms. The skin graft technique helps to restore both structure and function to the skin. It is a regenerative medicine technique often used when autologous skin graft is insufficient or not available. The skin graft technique is separated into biosynthetic skin substitutes and autologous culture or non-cultured skin engineering products. These skins are designed to close the wound temporarily or permanently, providing a mechanical barrier to infections and fluid loss. They also possess some of the biological and pharmacological properties of the human skin. They promote new tissue growth under ideal conditions for healing. The cultured skin engineering products is made by bioengineering of different types of skin cells, such as the patient's own skin cells, tissues from donated cadavers, animal tissue cells, and many other cells. The synthetic skin substitutes are constructed out from non-biological molecules and polymers that are not present in human normal skin. These constructs should be stable, biodegradable, and provide adequate environment for the regeneration of tissue. It should maintain its 3D structure for at least 3 weeks to allow ingrowth of blood vessels, fibroblasts, and coverage by epithelial cells. Now let us welcome Voisin to give an example of skin graft.
Hi, I'm Limbizen SP298. Thank you, Yokching, for passing the mic to me. And now I'll talk about the examples of skin graft. As mentioned earlier, skin graft can be classified into biosynthetic and synthetic ones. First, I would like to talk about the examples of biosynthetic skin graft. As you can see, the most commonly used are cadaveric skin allograft, porcine skin xenograft, and anion. Due to the lack of time, I'll just explain about the cadaveric skin allograft. There are actually two types, which are cryopreserved allograft and GPA or glycerol-preserved allograft. I would like to give a warning since the next slide is a bit gory. So as you can see here, the patient is suffering from skin burn, right? And those white patches is actually skin graft used as a temporary treatment or permanent treatment. And as you can see, the result is actually quite good in picture D. Now I will talk a bit about why GPA is more widely used than cryopreserved allograft. So first, from the name, we can deduce that cryopreserved needs to be preserved in very low temperature, right? Preferably using liquid nitrogen. Thus, we can see that glycerol or GPA here is no doubt a better choice since it just needs to be preserved in 85% glycerol. Therefore, it is simpler, cost-effective, and easily distributed to all places. In addition, it also has antimicrobial with antiviral properties due to the high glycerol concentration. Now I would like to touch a bit on synthetic skin graft, and here are the products available like BioBrain, Dermagraft, Intergraft, Epigraft, and so on. So for the Dermagraft, it is a bioabsorbable polyglycine mesh seeded with allogenic neonatal fibroblasts used to temporarily or permanently cover burn, chronic, or diabetic wounds. So in conclusion, dermagraft seem to be producing results as good as allograft with regards to like wounds infection, wounds exudate, wounds healing time, wounds closure, and so on. So from the patient, it seems that it is also reported to remove more easier. Now, you must be wondering if this skin graft technology is readily available in Malaysia, and fortunately, the answer is yes. One of the company is Medibits that is specializing in supply and distribution of product for burn care and skin transplantation for surgery purposes. The product of skin graft that they are supplying is ETB Bislife homograph, and this is similar to one of the derivatives of GPA. And yeah, the company is registered with MOF, authorized by Medical Device Authority Malaysia, and so on. And the skin graft or the ETB can be tailored to the size can be tailored in general. So here are some of the doctors that are specialized in skin graft technology, like Dr. Shamala or Dr. Tan, with both of them having 20 years of experience. Other than both of them, there are still several doctors available. And that's all for me, and I would like to pass the stage to Liliana to explain about the application and ethical or health issues of this skin graft in Malaysia. Thank you.
Assalamualaikum and hi, my name is Nurliana binti Ismail and my metric number is SB20091. Today I will talk about the application of skin graft in Malaysia. Diabetes is expected to affect 7 million Malaysian adults aged 18 and older by 2025. Diabetes can reduce the ability of skin to heal itself. Even small cuts on the feet can develop into diabetic foot ulcer. It is a non-healing wound that are vulnerable to infection. Diabetic foot ulcers are major causes of lower limb amputations, disability, and death in people with diabetes. Hence, skin substitutes are the method that have been introduced in the year of 2018. Skin substitutes are used in the treatment to repair full thickness skin loss. It is also a permanent skin substituent and to replace the skin loss due to burns, injuries, and disease and infection. It is used to also the prevention of infection, to open wounds that will reduce the greatly dreaded solution of amputation. Thus, it is very helpful for diabetic patients who generally suffer from the poor wound healing. With skin substitute that have been genetically modified, a patient with diabetic disease can repair their skin which have wound that will not allow them to have any amputation that causes by any infection. Thus, this will be very helpful for the diabetic patients in Malaysia. Cell Tissue Technology Sdn Berhad, or also known as CTT, is a Malaysian-based company established as a spin-off from the National University of Malaysia, or UKM. One of the early ideas behind the formation is to manufacture and commercialize MyDerm, an autologous tissue-engineered medical product researched and developed by the Tissue Engineering Centre of UKM. Currently, there are less than 10 companies in the country adopting advanced medical technology as their core business activities. Many are still wedged at the pre-commercialization stage and none has boasted any success story in the market. CTT aims to be the front line of the Malaysia advanced medical industry in areas of tissue engineering and regenerative medicine. The first step towards this direction is the introduction of MyDerm, the first tissue-engineered human skin in Malaysia. MyDerm is an advanced 3D autologous skin substitute meant for the repair of full-thickness skin loss. This skin substitute is permanent, able to replace the traditional skin and have proven to enhance the wound healing. MyDerm is mostly used to replace skin loss due to burns, injuries, disease, and infections. MyDerm contribution into medical scene is enormous and significant. more so for the diabetic patient who generally suffer from poor wound healing. The prevention of infections to open wound will reduce greatly the dreaded solution of amputation. Next, I will talk about the ethical and health issues that related to skin graft or skin substitution in Malaysia. To ensure the effectiveness and safety of skin substitution, extensively used clinical on patients have been done. The research and development for this product was completed in big animal study and limited clinical application since June 2008. The prototype also underwent several tests such as toxicology for safety, rejection on implantation, and flow cytometry cell cycle analysis. The researchers are very confident that the introduction of this substitute will revolutionize the local medical industry, thus bring hope and solution to people who need it, especially for the diabetic patients that are mostly the most highest cases in Malaysia. Doctors, patients, surgeons and consultants are very look forward for this method. With that, thank you.